Mentions of stress related to combat can be dated over 2,000 years ago. Ancient tales of battle trauma and flashback-like dreams were documented by the likes of Hippocrates. In 1761, physician Joseph Leopold observed that those who were exposed to military trauma experienced sadness, sleep problems, anxiety, which he called nostalgia. In the 19th century, railway spine was a common term for post-traumatic symptoms of passengers involved in railroad accidents. In 1865, Charles Dickens survived a railway accident. He reported having troubles of sleep and anxiety due to trauma. In 1871, Dr. Mendes da Costa studied Civil War soldiers showing symptoms of rapid pulse, anxiety, and trouble breathing. He described it as an overstimulation of the heart's nervous system. When World War I ended, military soldiers experienced what they call shell shock. They were showing symptoms of panic, meltdowns, unresponsiveness, sleep problems, lost memory, sensation, and capacity to feel, among others. It was then observed that similar symptoms are present to soldiers who had not been near explosion, thus they changed it to war neurosis. In World War II, the diagnosis was replaced by combat stress reaction or battle fatigue. Soldiers were battle-weary and exhausted. Such conditions were treated using PIE principles. In 1952, the American Psychiatric Association produced the first diagnostic and statistical manual of mental disorders, which included gross stress reaction. This diagnosis was proposed for people who were relatively normal but had symptoms from traumatic events. In 1968, the condition was included in the DSM-2 pertaining to adjustment reaction to adult life. It was limited to 3 examples of trauma: unwanted pregnancy with suicide thoughts, fear linked to combat, and Ganser syndrome. In 1980, the psychological trauma experienced by U.S. Vietnam veterans and their demand for compensation led to the inclusion of PTSD as a mental disorder in DSM-3. It's a condition that occurs not only on the military but also in civilians who experience traumatic events. In the DSM-5, PTSD is no longer an anxiety disorder. It is now in a new category under trauma and stressor-related disorders. It may occur in people who have experienced and witnessed a traumatic event. Its symptoms include intrusion, avoidance, alteration in cognition and mood, and alteration in arousal and reactivity.